Welcome to our course on autism spectrum disorder and behavior. What is autism? Autism, or autism spectrum disorder, or ASD, is an umbrella term for a wide spectrum of disorders which include autistic disorder or autism, Rett syndrome, childhood disintegrative disorder, Asperger's, pervasive developmental disorder not otherwise specified. Those all fall under the umbrella of autism spectrum disorder. Autism is a neurobiological and developmental disorder. It's most commonly diagnosed in early childhood, and early detection is extremely vital. There are 4 times as many boys diagnosed with autism than there are girls. There are no known cures and no defined proven causes, though science leans towards a combination of genetic, environmental, and psychological factors that contribute to the development of autism. There are some specific traits associated with autism. Persistent deficits in social communication and social interaction. This can look like no receptive language, no expressive language, no eye contact. It can look like a person who has no friends, even when given the opportunity to play with others. Another trait is restricted, repetitive patterns of behavior, restricted, repetitive interests and activities. This can look like the person who only eats 2 different kinds of food, and they're very specific from the same store every time. Or someone who is hyperfixated on one subject or topic, such as trains or dinosaurs or Johnny Depp. Another symptom is, or another trait is sensory processing and regulation issues. This can look like someone who is reactive to loud sounds. They can't be in public because they have extreme reactions to loud noises. It can look like someone who can't wear jeans because the fabric doesn't feel right. These symptoms present in early childhood in the early developmental period. Some things that are commonly diagnosed as other things when they're actually autism are trauma and stress-related disorders, anxiety disorders, mood disorders. Some people are diagnosed with impulse control disorders, and it turns out that a lot of them had autism instead of those other disorders. What is behavior? Behavior is anything a person says or does. It's the way that one acts or conducts oneself, especially towards others. And most importantly, not on this slide, behavior, as we know in the DSP world, behavior is communication. So it's anything that we do, and it's also a form of communication. What are some common challenging behaviors for autistic folks with autism? Flapping is one of them, flapping arms. If it impedes their ability to live a happy, healthy, successful life, that can be pretty challenging. Eloping is extremely challenging. Eloping means running away. That can cause serious safety issues, can be extremely challenging if it happens in public, in places where there's a lot of risk for danger. Eloping is super scary. Manipulation and lying are also challenging behaviors, sometimes without reason. We want to know why a behavior happens. Behaviors happen because they are communicating a certain function. So we use the acronym MEETS to determine the functions of behavior. Well, not to determine, but to illustrate the functions of behavior. And MEETS, as you can see, stands for medical, escape or avoidance, attention, tangibles, or sensory. So somebody could be acting a certain way because they are receiving sensory input. This feels good, so I'm doing it. Sensory input, sensory stimulation. They could want a tangible item. I'm engaging in a behavior because I want some item. I could be engaging in a behavior because I want your attention, whether that's positive attention or negative attention, being yelled at. I'm engaging in a behavior because I want to avoid or escape something. Or I'm engaging in a behavior for a medical reason. Those are all functions of behavior. So how do we figure out what the function is? Why are you doing what you are doing? Just remember ABC. ABC stands for antecedent, behavior, and consequence. All you need to remember about the A is that it happens before. The A happens before the behavior. An antecedent happens before the behavior itself, what the behavior looks like, who's involved in the behavior. Is the behavior being done to someone? What does it look like? Are they using their left arm or their right arm or hitting a certain item? Be specific. And the consequence. Consequence does not always mean something negative or a punishment. A consequence is simply what happens after the behavior, a consequence of your actions after the behavior. It doesn't mean how if they were sent to their room or punished or something was taken away. It just means right after that person engaged in that behavior, what happened in the room? Did you respond a certain way? Did somebody else intervene? Was somebody called? Did the person just go on with their lives? Be specific about what happened after the behavior. Now, over time, you can establish patterns of behavior that will help you determine what the function of the behavior is. If it happens in certain environments all the time, around certain people all the time, at a certain time of day, does it only happen at day support? All of those specificities will help you determine why that behavior is happening. So here's our example. The antecedent. What happened before the behavior? John went into the kitchen and opened the refrigerator door. The behavior was John slammed the door closed and punched the wall on the side of the fridge. The consequence was John's mom yelled at him for punching the wall. A, B, C. What happened before? What happened during the behavior? And what happened after? If we record this and see over time that there is a decrease in his frequency of checking the refrigerator when mom's not around, but he continues punching the wall and checking the fridge when other people are around, it may mean something different than maybe he's just communicating that he is hungry or upset. You have to take enough data over a certain amount of time in order to establish what that function is. You can't just assume that he slammed the door and punched the wall because he was hungry. Maybe something was missing specifically. Maybe he needed help or he remembered something. You won't know until there's established pattern, and finding out the ABC each time will help you determine that function. Then we have antecedent interventions. We know that antecedent means before. So these are proactive interventions, ways that we can intervene to help prevent or change those behaviors before they happen. They happen before the behavior occurs. So using a visual schedule, prepping someone to know what their day is going to look like. If it normally upsets them to not know what's happening in their day, that could be an antecedent intervention. A chore chart or giving verbal prompts to remind someone to grab something before they run out the door. Don't forget your cell phone. Before they've forgotten the cell phone and engaged in a behavior, that's an antecedent intervention. And then we always want to consider replacement behaviors. Obviously, there's a a different way to communicate someone's needs other than engaging in one of these behaviors. So, for example, Ben elopes. That's his behavior. We want to prevent eloping. We know he elopes every time he's in a loud environment. How do we prevent that from happening? Maybe we know because we did the ABC log over the last couple of times that Ben doesn't want to be in a loud environment, but providing him with sound-canceling headphones allowed him to remain in the environment and continue with the rest of his day. So providing those headphones to him was not only an antecedent intervention, but now you're providing him with a replacement behavior of using those headphones instead of eloping. And a reinforcer or reinforcement is something provided as a consequence, so after the behavior, that increases or maintains the behavior. Some examples of appropriate reinforcement are verbal praise. Nice job, you did awesome. She's gonna love that gift you got her. Verbal praise, celebrating social praise. Rewards, a movie night at the end of the week for a week of chores done, or money earned for a job done. Those are all appropriate reinforcers. Food is not an appropriate reinforcer. It is the easiest thing to use as reinforcement, and it is not appropriate to use as reinforcement because food should be naturally earned, and food should not have demands placed on it before being given. There are some other reasons for behaviors like side effects to medications, diabetes, traumatic experiences, and there are other types of supports available to those with autism spectrum disorder, like occupational therapy, physical therapy, speech therapy, sensory stimulation. Those are all therapeutic supports that are available to folks with ASD. We're going to take a quick little practice test before I send you on your way to your real test. Autism is a developmental disability that originates prior to birth or during early developmental years and is linked to everything except social factors. When decreasing inappropriate behaviors, is it acceptable to ignore? It is acceptable to ignore the behavior, not the individual. True. Ignore the behavior, do not ignore the individual. A developmental disability is a disability that results in substantial limitations in which of the following areas? All of the above. Autism is found most in families from lower socioeconomic groups. False. The number of boys with autism is 4 times greater than girls. True. The following are traits of autism except sexually deviant behaviors are not a trait of autism. When observing negative behaviors, we use the acronym MEETS. Name as many of the needs of the individual may be trying to meet. What are these functions? Medical, escape or avoidance, attention, tangibles, that'll be a hard one, or sensory. John runs away when he is in a loud environment. Which would be an example of replacement behavior or support? B. The following are all common mental health disorders except psychotic disorders. Anxiety disorders are often misdiagnosed as impulse control disorders. True. Behavioral problems may also arise as a result of past traumatic experiences. True. Flopping, eloping, and manipulation or lying are common challenging behaviors. True. What are considered proactive or antecedent interventions? All of the above. When observing, documenting, and reflecting on behaviors, which acronym is used? ABC, antecedent, behavior, consequence. An example of therapeutic supports is all of the above. Click too quick on that one. Early detection and intervention is important to the success of an individual diagnosed with autism and/or intellectual or developmental disorder. True. That's the end of our behavior and autism spectrum disorder course. Do not forget to take the quizzes below. If you have any questions, reach out. Good luck.